Casting, supporting your senior pet, presented by Dr. Becky Schoenberg of Autumn Care and Crossings, and this is sponsored by the Chelmsford Dog Association.
All right.
Becky.
So, like I said, my name is Dr. Becky Schoenberg. I run Autumn Care and Crossings, house called Veterinary Hospice and Palliative Care. I am a certified hospice and palliative care veterinarian. And we're going to talk about caring for senior pets today. I can't tell you anything specific about how to treat one particular disease or one particular patient right now, but what I hope I can do is help you find some tools to help support your pet and yourself, and help figure out how best to take care of and support their quality of life, whether you have a senior pet now or whether you're just looking ahead to a future when you're dealing with these challenges. I know we don't have a huge number of people here, but if anybody has any questions at any points or any comments or anything that you want to say, chime in. I do a lot better with dialogue than with a monologue. One of the biggest things that calls me to this, and one of the biggest things that I want to talk about, is kind of the benefits of having a senior pet. There are a lot of challenges, and we're going to spend a lot of time talking about that, so I always want to start out saying, what are the good things about having a senior pet? They're a lower activity burden. Puppies are fun, young dogs are fun, but an older pet is a little bit less of a workload in that way. They give you more peaceful social time. They're more likely to curl up on the sofa with you. Older pets are great snuggle buddies. And one of the biggest things that I've found working with senior pets is that for a lot of people, this is a period of your pet's life where you have a chance to give back to them. They give us so much. They are such supporters and such caregivers for us throughout their lives that having an older dog or a cat, having an older pet, is an opportunity to repay some of that love and devotion and affection to them in a way. Because, and we'll talk about this a little bit later on, when you're caring for a senior pet or a chronically ill pet, your role in their life changes. One of the other things that I do want to talk about is just a couple definitions here, as we talk about what is palliative care, what is hospice care. And this is going to be more about palliative care than hospice because we're talking about senior pets in general. And these are words that tend to be scary to people because we come at this from a human medicine perspective, and we think of hospice as giving up, as throwing in the towel, saying, well, we're not going to try anymore. And that is an unfortunate product of the American healthcare system. In veterinary medicine, while we are very much informed by human medicine, we have some freedoms that they don't. So palliative care is just defined as care that supports the comfort and quality of life of a patient, and care that manages their symptoms. And one of the biggest benefits in veterinary medicine is that it can be employed at any time. It doesn't mean stopping curative care. It doesn't mean giving up or quitting. It means that we're going to work on making sure that this patient is comfortable. And when I talk about a patient, I'm talking about the people as much as the animal, because the animal does not exist in a vacuum. And part of caring for an older pet is the burden on yourself. And part of a veterinarian's job is to support you as well as your pet, and to come up with a way to care for them that takes your lifestyle and your bond and your needs into consideration. When we're dealing with older pets, one of the biggest things that I like to remember, this is something that was taught to me by a mentor: age is not a disease. So many times I hear people come in, well, she's just old. Well, you know, he's slowing down, but what do you expect, doc? You know, she's 14. Being old does not cause you to slow down. It doesn't, because, oh, she's losing weight, but she's just old. Being old doesn't make you walk slower. It doesn't make you lose weight. It doesn't make you slow down. You can have a very young animal that's very sick. You can have a very old animal that's very healthy. It's the same way people say, oh, we can't do that procedure, she's old. If you look at human medicine, Who's having most surgeries? Who's having most procedures? Senior citizens. Exactly. You know, no one says, you can't have that hip replacement, she's 55.
I just had one 2 years ago.
Exactly. So
Everybody said, you're so young.
age in and of itself is not a disease. Being older does mean that pets are more prone to develop health problems. But those health problems are in fact things that we can treat. We can't treat age. I can't make your dog be 5 years old again. I can treat the health problems that they're more prone to as they're aging. And they can be, these are things that even if they can't necessarily be cured, they can be managed and they can be palliated. Being older is not a reason for an animal to live their life in discomfort. It's not a reason to ignore these symptoms just because, oh well, probably just old. And there are a lot of common problems that will come up in senior pets. I'm going to be talking mostly about dogs here because this is a dog group, but these are all applicable to any species.
And we do have many people in the group who have both dogs and cats.
Yep. And if anyone has any questions about cats, I know if people are watching online, I don't know, like I am, or text in, email me. I'm sure that we can get my email address up there, or if anyone has any questions here. But most of these problems, if we can recognize them, we can support them. So what's one of the most common things that older dogs face? Dental disease. So common. Whether it's because they have been chewing on tennis balls for 12 years and they have worn their teeth down to nubs, whether it's just plaque and tartar. And this is something that a lot of people don't recognize is causing discomfort. They think, oh yeah, he has bad breath, but you know, I can live with bad breath. But that can be a significant source of pain and discomfort, and it's something that can be easy to treat and improve their comfort, whether that's a full dental cleaning or whether it's just talking about ways that we can improve their hygiene without going through an anesthetic procedure. Older pets have different nutritional needs. A lot of times people will say, oh, you know, she's losing her appetite, she's just not eating, oh, she's probably just old. But part of that can be that as they're getting older, they're having changes in their organ function. Their liver is not working as well, their kidney's not working as well, they're not digesting food as well. It can be changes in their gut flora. We all have good bacteria in our GI tract that help us digest our food. And that population can change over time, make it so that it's easier or harder for them to digest some things. One of the other biggest things that does happen too is just as, you know, one of the things that do happen, our senses get a little bit less acute, get a little bit nearsighted or a little farsighted, get a little bit hard of hearing. Some dogs, they lose their sense of smell. It's not as acute. And an animal, they don't look at a bowl of food and say that's food. They don't recognize their food by vision, they recognize their food by smell. And so we can work with that and say, oh, they're not smelling as clearly. We can find ways to make their food smellier, for lack of a better word. Mm-hmm. And that can do a lot to enhance appetite in an older pet that's having appetite problems. I touched on this a little bit already, but we do see organ problems as they get older. We do see animals develop, you know, decreased kidney function, decreased liver function, and those are things that, again, we can track, we can support. We can either adjust their diet to make it easier on them, we can monitor it, we can make a lot of different changes to help keep them feeling well. One of the hardest things that we have to deal with in senior pets, and one that we're still learning a lot about, is cognitive dysfunction. And that is a fancy Latin way of saying Alzheimer's. And it is in fact the same physiological process that happens in human beings. They get the same plaques in the brain, and so as dogs get older, they just get a little confused. And this can be as simple as, you know, taking a minute to recognize when you come in the door, wait a minute, who are you again? You know, it can be, you know, going to the wrong side of the door when they're getting ready to go out. We see this a lot in those dogs that, you know, they sleep all day, and then around 7 o'clock at night they wake up and they start barking and barking and barking.
Is it like sundown?
Yes, it is exactly sundowning. It is the same thing.
Yeah.
They lose their sleep-wake cycle. They'll wake up at 2 o'clock in the morning and they'll suddenly either be like, I'm very confused and lost, where am I? Or it's breakfast time now. And it can be hard to recognize, because again, this is another one that gets kind of brushed away in the just old. And there are things, this is one that is hardest in a lot of ways on the people, because it is frustrating, because it is exhausting. This is a disease that unfortunately attacks the human-animal bond. And this is one where our role as veterinarian is as much to support you as it is the pet. And kind of the number one thing that everyone asks about: arthritis, pain, joint problems. And this is one of the areas that is in some ways hardest to recognize and easiest to treat. Once we know that the problem is there, we have so many tools. So that's something that I am going to spend a lot of time talking about. People always say, oh, animals mask their pain. Animals do not mask their pain. Animals tell you very clearly, they just speak a different language. Another one he hears, oh, well, he's not crying, he must not be in pain. You had a hip replacement. How long were you in discomfort for after that?
6 to 8 weeks.
Were you screaming that whole time? Vocalization is a response to acute pain. Someone steps on my foot, I'm gonna go, ow!
Yeah.
But I'm not gonna keep owing for the next week.
I have a high pain tolerance.
That too. and pain tolerance is a thing that varies among animals as well. But vocalization isn't a way that animals respond to prolonged pain or chronic pain. Another one I hear, well, he's not walking on that leg, but it doesn't hurt. If they're not walking on that leg, it's because it hurts. Or, he's just slow. Slow is usually discomfort. A lot of the other things that we look for when we're assessing pain in animals, and I've got some handouts, we can put them online if you want. We look at their facial expression and their body language. If you look at a person who's in pain, you see a little line here, see their eyes narrow, their lips tense up, and we see those same changes in dogs and in cats. You see their brow furrow, you see their eyes narrow, you see their whiskers kind of push forward, you see this little fold right around here. And these are small, subtle changes that, once you learn to read them, can be a really good way to tell if your pet's comfortable. And I'm gonna go take a small detour into cats here. The number one sign of pain in cats is jump height. The cat used to jump onto the top of the fridge. Now it goes from the floor to the chair to the table. It's taking steps. That's because they're uncomfortable. It's because their hips hurt, their legs hurt, their knees hurt. They can't make that 5-foot jump anymore. Other changes that we see that can be signs of pain, again, sleeping a lot, not wanting to get up. They're just like, I could go for a walk, but I'm just gonna lie here instead. I'm gonna lie down. And loss of interest in their favorite things. They used to love to play with that toy. Again, going in and doing house calls for hospice care, one of the questions that I always ask people is, what is your pet's favorite thing to do? And I hear a lot of, well, they used to. They used to love playing with the ball. They used to love going to the park. They used to love this. This is something that is a sign that we need to intervene. Another thing to keep in mind is that periodic activity does not mean that they're not in pain. Say, he's slowed down, but still, when the mailman comes to the door, he'll still get up and run to the door. It's just a matter of, and they're making these same calculations in their mind. Is it worth the pain to get the thing? And I say, it's not worth it to get up for mom, but if it's mom and a piece of cheese, that's worth it to get up. And they're doing these calculations. They're saying, I will put up with the discomfort to get the high reward. And pain, a lot of people, and we also hear and this is another toxic part of our culture, no pain, no gain. Pain is weakness leaving the body. Pain is, ephemeral, joy. That's malarkey. Pain is, in fact, a disease. Pain, in and of itself, causes physical changes in your body. Pain causes stress, which causes lowered immune system. Pain actually physically affects the nerves in your body and changes the way they conduct signals to make it easier for them to continue conducting more pain. The longer you're in pain, the worse pain you'll be in, and the harder it will be to stop that. So the earlier we can intervene, the better we can support them. And one of the other, and I've been talking about that a lot, but overall, the other thing that we look at is quality of life. And quality of life is more than just not being in pain. Because that's another one that I get asked a lot. Doc, really what I want to know is she in pain? And you can have an animal that's in pain but still has a great quality of life. And you can have an animal that is not physically in pain, but is not enjoying their life. So we try to look at what else means a good quality of life for an animal. Are they able to do their favorite things? Are they able to get up and around and engage in normal behavior, not just for that individual, but for that species? Are they still able to enjoy socializing with their people and their humans and the other pets in the house, if there are any? And if not, what can we do to help fix this? And there are two ways that we address quality of life. We try to say, we all have positive and negative impacts in our life. So we look at what negative things can we take away, but also what positive things can we improve. So if you have a dog that used to love to chase the ball, and we can work on, they're stiff, they're arthritic now. How can we, and even if we can manage their pain, maybe running isn't going to be good for them. What can we do to play ball without running? And I have a lot of my older dogs that play reverse ball, whereas the dog will roll the ball and the human will go and pick up the ball and roll it back. And it is a way to take that thing and engage it in a different way. Or we'll play old dog ball, where instead of throwing it across,
Do they have
roll it.
equitherapy for dogs, or is that typically
They do.
after an operation? Okay.
So there are a lot of ways to treat pain.
Yeah.
In animals, we have anti-inflammatory pain medications, and that's the first thing that everyone thinks of. Give them a doggy Advil.
No.
Don't give your dog actual Advil.
No.
And there are other medications as well. A lot of times, especially in senior pets, we have it's called multimodal pain management, where one medicine by itself isn't enough, but two medications that will attack the pain at different points in the pathway will get you more than twice as much pain relief. We have physical therapy, we have massage therapy, we have cold laser therapy, aqua therapy. So we are kind of in a renaissance of pain management for animals right now, as well as for humans.
Is acupuncture ever used?
Absolutely.
Okay.
You do, I'm going to go on a little high horse here and say, if you're going to be getting acupuncture, you want it to be done by a veterinarian. There are human acupuncturists who practice on dogs. I think it's generally better to get a veterinarian who's certified in acupuncture,
Okay.
because they're going to be more familiar with the lines in the anatomy in a dog or a cat or a horse or a ferret. Same thing with physical therapy and rehab. You want to get someone who's a certified canine rehabilitation therapist or a certified canine physical therapist. There are a lot of facilities that will do it, and for really big dogs, one of the biggest challenges with treating them is getting them into and out of the car. There are people who will come and do house calls for all of these things. And for most animals, we wind up needing to use multiple of these modalities. We wind up saying, okay, you're going to be getting your once a month acupuncture and your weekly physical therapy, and you're going to be on this and this medication, and we're going to adjust your diet and add in these supplements. And this is another thing that segues really well into one of my philosophies, which is patient-directed care. In traditional Western medicine, you have a very kind of parent-child relationship. You go in, you say, this is what I'm seeing, doc. And the doctor says, okay, this is your diagnosis, here's your medication. Especially when it comes to senior pets, when we're often dealing with multiple health problems that will all impact each other, and we're dealing with this impact on the family and a much greater burden of care, I like to work in what's a much more like peer-to-peer relationship, where you'll come to me and say, this is what I'm seeing. We'll say, well, which of these things are most concerning to you? Which do you think is having the most important, the greatest impact on your pet's happiness and on your quality of life? And then we'll sit together and we'll make a plan together. And this is a phase of life where nothing is dictated. You can't really say like, well, you have to do this and this and this and this and this. You wind up getting a much better management and a much better relationship when the doctor will say like, okay, here's some things that we can do. And then you'll say, this I think I can do, that is just not going to work with our lifestyle. This I want to try, but maybe not. And that way you can put together a care plan that is best for your situation, because nobody has infinite resources. We all have resources of time, and we have resources of money, and we have resources of personal emotional fortitude, and no one is infinite in all these things. So you may have someone who, I work from home, I can give medicine every 4 hours, no problem. And you may have someone who says, I have to travel for work every other week, I can't take them out, or I can't do a weekly visit. And these are all things that you have to work around, because it is important to consider yourself in this equation as well as the animal. This is also a place where it's easy to kind of feel really, really guilty. And you think, oh my goodness, if I can't do 17 medicines 5 times a day and take them to the physical therapist and take them to the park, I'm a bad mom. I'm a bad doggy care. You are not. The fact that you are asking these questions means that you are already above and beyond most pet parents, caregivers, owners, whatever you want to call yourself. You are a patient as much as the pet is. And you are part of the unit of care. There is no wrong choice in this. Sometimes I will go into a family and I'll say, here's things that you could do in this situation. Thank you for helping us. You've given us some clarity of thought. We're not gonna take any steps right now. And that's okay. Sometimes you need some time to sit and think and internalize. Sometimes you need to just be aware of what your limitations are. And it is a lot better to say, I know myself, I know my situation, I know I'm not gonna be able to do all these steps than to commit to taking on 75 things and then not be able to.
Have you had situations where you don't feel like A, B, C, D, E is gonna work, but the family, the owners keep saying, well, why can't we try this, why can't we try this?
So, one of the biggest, so, if you look at my next bullet point here, it's communication. And this is an area where communication is incredibly important. If you ask me, do I ever treat the owners instead of the pet? I try to treat the unit. And so there are times that people will say, can we try this? And what I'll do is I'll try to say, I have not had as much luck with this, or I don't think it's going to be effective here. And I will also be honest with people. I'll say, this isn't gonna help. If it would make you feel better to give it, I don't think it's gonna hurt. If I do think it's gonna harm, I will not include it in my care plan. But there have been times that I say, this is not gonna help your dog. It's not gonna hurt your dog. If it will make you feel better to do it, by all means, do. Another thing that I do a lot of with senior pets is making up a medication or treatment priority list, because it's hard to give pills, it's hard to give medicines, and that's another way that a veterinarian can, especially one with focus on palliative care or senior care, can help you, is finding new ways to get meds into your pet. Working with compounding, working with transdermal medications, which is especially great for cats. It's just putting medicine on the inner skin of their ear and letting it absorb. Not all medications can be given that way, but a lot can. Some animals do better with shots than pills. Working with training you how to give an injection. Working with our super, super secret tricks to make dogs take pills is liverwurst and hickory smoke pill pockets. Those are the two
What's
things.
it, liverwurst and what else?
Liverwurst or hickory smoke flavor pill pockets. Those are the two that are usually when nothing else will work, will. But we have our little tips and tricks, and we'll work with you to find ways. But I found in a lot of these cases, it's helpful to make a priority list. And this gets into both letting go of guilt and in focusing on quality of life. Sometimes increasing quality of life means decreasing treatment. If your pet hates taking those pills, hates getting that needle, hates going in, it can improve their quality of life to say, okay, we're not gonna push this anymore. We're gonna stop this medicine because it's causing them more stress and trauma to give it than it is help giving them benefit. But yeah, priority list will be like, okay, if you can only do one thing, get this medicine into them. If you can do two things, do this and this. If there's one that's least important, this is the one that you can drop off the bottom when you're having a stressful day. Whether that's, my dog is having a cranky bitey day and doesn't want to take his medicine, or whether it's, I have to work a double shift and then go to my kid's soccer game and I don't have time to come home and give pills 3 times a day. But communication is the most important thing. It is absolutely fine to have a priority list for medications as long as you're working with your doctor and letting them know. If we put together a care plan and then I get a phone call a month later and you say he's not doing well, and I say, well, what about these meds? Oh, I stopped giving those 3 weeks ago. I can't help you if I don't know what's going on in your life. And it is incredibly important to talk to your doctor, your vet tech, your veterinary care team, and let them know. If a medicine isn't helping, tell us. And we may be able to adjust the dose. We may be able to adjust the frequency. We may be able to adjust the format. Or we may be able to say, okay, let's stop this medicine and try another one instead of just stopping giving it. If a medicine is working really well, tell us, because that may give us more information about the nature of the problems. We say, oh, this is working really well. We know, then okay, then this means that this other thing may also be even more benefit, or we can say then we may be able to back off on that. If you are not sure, if you're concerned, if you're worried, again, we're here to take care of you as much as we are the animal. I always tell my clients I would rather get an email every day, even if it's just saying like, she usually sleeps on this side of the bed and today she's sleeping on the other side of the bed. And I'd be able to reassure you and say, no, this is okay, it's cool. Then have there be a catastrophe and have you say, oh, I don't want to bother her, I don't want to be a nuisance, it's probably nothing. I know that there was something that I could have helped you with, whether it's a problem that I could have fixed, or whether it's just that I could have eased your stress and eased your worry and helped you feel better. And what sort of things can your veterinary team do in this phase of life? One of the biggest things that we can do is we can educate. We can explain, we can tell you, here is what's going on, here's the physical changes that are happening in there, here is, and this is a big one, what to watch for. How is this going to play out over the next week, month, 6 months, year? As this condition progresses, as they age more, what would be a sign that he's not feeling well? What would be a sign that it's time to change the treatment plan? What would be a sign that it's time to intervene? And this is not something that anyone wants to think about, but when this progresses to a crisis or an end-of-life point, what should I watch for? Because that's going to be different in every situation. Heart disease, as it progresses, is going to be different from kidney disease. As it progresses, is going to be different from dementia or arthritis. And knowing what to keep an eye out for and knowing what to expect can ease a lot of stress, can ease a lot of worry, and can help keep pets comfortable and alive longer by being able to intervene early on. We can provide treatments and support, and that can take the shape of pills and prescriptions and medication. It can take the shape of, finding the best harness. Big old dogs that have trouble getting up from lying down, you can say, this is the harness that's going to fit him best. This is one that's going to be the most comfortable to him. Environmental support, whether that's, for if you have a kitty, saying, why don't you move the litter box from here to there? I have lost count of the numbers of dogs whose lives I've changed by telling people to put down yoga mats. Again,
just sleep on that?
No, traction.
Oh, okay.
Especially big labs that like to do this when they're standing because they don't have the core strength that they did when they're little. And they are slipping, they're falling, and you put down some indoor-outdoor carpet or some yoga mats, and they suddenly they can eat their entire meal without winding up doing this
Yeah.
or falling down. I was talking about trouble getting in and out of cars. We can help you figure out what the best ramp is. Because a lot of people, I got a ramp, I got stairs, but he won't use them. It matters what the rise of the stair is, what the incline of the ramp is, how wide it is, how it's positioned. We can help you with that. We can help you put together a nutrition plan and say, feed this, not that. If you want to do home cooking, we can help you come up with a complete and balanced diet. We can help with supporting you. One of the biggest challenges, and this is a big one for dogs with cognitive dysfunction, is letting people know that there are resources out there. There are dog walkers, not just who will come and take your dog for a walk, but a lot of my senior pets have dog not walkers, and they will have people who will just come and hang out with the dog, sit with them, pat them, reassure them. And this is also great if you have a dog, again, that's on a lot of medications. It can be a huge exhaustion, and I was told it's okay to take a break. We can send in a vet tech and say, tonight they're going to give all the meds, and you're going to not have to worry about that. If you have a dog that is a night waker and will wake up at 2 o'clock in the morning and cry and cry and cry, take a night, get a hotel room, hire a dog sitter. And for that night, you're going to get 8 hours of sleep. And exhaustion is a burden, and stress is a burden. One of the biggest challenges with being a caregiver for a senior pet, like I mentioned at the beginning, is that this is a change in your role in their life. This may have been your running buddy or your bicycling buddy. This may have been your best friend, and now it's like taking care of an elderly relative. It is a big difference. You're no longer cool mom. You're now the lady with the pills. And that's a big difference. And they're no longer the little guy that greets you at the door and wags their tail and sniffs. Now they're the dog that just kind of stands there and goes for an hour at the wrong side of the door. And it's hard. It's stressful. It's exhausting. And it is work. Not just in terms of time, and okay, I have to be home every 12 hours, or I need to take him out every 6 hours, or he's going to pee in the house. But it is an emotional burden because it is a change. And this is now something that you have to do instead of something that you get to do.
Do you suggest those potty pads?
There are a lot of things that I use. So I've worked with pee pads, I've worked with diapers for some dogs. Some dogs won't tolerate them. I've worked with people who have dog sitters just come in multiple times a day. I had one little dog that would only pee on grass but got cold easily. We set up a little area of AstroTurf in their back pantry. So this is another thing we do, is creative problem solving. But it is important to acknowledge the stress that this takes on yourself, the burden of care, and the change in your relationship. And again, this is another place where it's important to be aware of your limitations. There are no medals for martyrdom, and it is important to let your care team know what you can and can't do, and it's important to have a support system of your own. This is where you reach out to dog walkers, this is where you reach out to friends and you say, oh my goodness, I just need a breather, or hey, what did you do when your pet went through this?
Well, I'm wondering if a dog probably can sense it's being a burden.
So I think that animals are very emotionally intuitive and very emotionally aware, and they're a lot more perceptive than we give them credit for. So I don't know that they quite have the comprehension of being a burden, but they know that I'm not happy, mom's not happy, I'm not happy that mom's not happy, and it gets into a spiral. And so this is why one of the other things that we work on is finding ways to add positive things into their quality of life, because pretty much anything that we can add to improve a pet's quality of life is also going to be something that you can do as a bonding experience with them. So finding new ways, finding new positive things to share with your pet, whether that's old dog ball or sniff walks, when people say, oh, they're so slow when they go for a walk. That's okay.
What about driving? I mean, my 2 dogs love to be in the car.
Oh yeah.
Okay.
If your pet loves car rides, then absolutely go for a sniff ride.
Okay.
Or for little dogs, stroller walks. People always roll their eyes and I'm like, no, put your doggy in a stroller and take it for a stroll, because you're gonna get the benefits of your walk. You're gonna get the benefits of like, yay, I'm having bonding time with my dog. They're gonna be smelling everything and sticking their little nose out and sniffing all the stuff. Because while I say yes, their sense of smell fades as they get older, it stays sharp a lot longer than their vision and their hearing does. If they used to like to play tug, you just play like gentle tug. Or you didn't used to be allowed up on the sofa. Maybe we're gonna ease up on that rule and let you be on the sofa and have sofa snuggles.
My younger dog goes after the older dog all the time, so the older dog has a safe chair.
Yep, and that's a really great
Once he
thing.
goes up there, Zoe doesn't bother her.
Yep, and this is the kind of thing that we try to incorporate to keep them happy and to keep you happy and to maintain peace in the home.
Yes.
Another thing to keep in mind, and this is not something that anybody ever likes to talk about, but part of having an older pet is being aware that we don't have our pets forever. And this is something that, while it's hard to think about, it's important to think about. Because when we're dealing with these aging problems, when we're dealing with these chronic problems, again, as a culture, we have a rough relationship with grief. And we have a cultural framework for how we're supposed to feel when we have a loss in the family, when we have a loss in the community. We don't have as much of a cultural framework on what we're supposed to feel or how we're supposed to react when we're dealing with a loss like this. And one of the biggest things is anticipatory grief.
Is what?
Anticipatory grief.
Oh, okay.
A lot of people, we know that we're supposed to be sad when they pass, but we're not aware always of the burden of kind of waiting for that shoe to drop. And in some ways, it can be a lot harder than the grief of the loss itself, because we don't know. So in addition to grief, there's uncertainty. And we say, is it gonna happen this week? Is it gonna happen this month? Is it gonna happen this year? I don't know. And we don't have the built-in cultural supports. Everyone knows to come and give you a hug, or if you're not a hugging person, come and give you support or bring a casserole or something when you have a loss. We don't have a cultural acknowledgement of I am anticipating a loss. And when we're caring for a pet, that is integrated into our daily life and relationship in a way that it almost never is in any other relationship. So it's important to take care of yourself. It's important to make sure that you're getting the sleep that you need, that you're finding as many positive factors in your relationship as you are. And it's important to reach out for the help that you need, whether that is talking to your community, whether that is talking to a grief counselor, talking to a social worker or a therapist. It is hard, but it's important. And the other thing to know is that there's no right or wrong way to feel. There is no appropriate timeline for loss. And people will say, oh, get a new puppy. Oh God, that was last month. Are you still sad? And they are coming from a place of meaning well, but not being helpful. Because the fact that one person grieved one way doesn't mean it's the same way that you are gonna feel. And and just because you feel that way doesn't mean that your spouse or your partner is gonna feel that way as well. And I'm actually gonna circle around and make an addendum to communication. In addition to communicating with your vet team, communicate with your family. Because one of the other challenges that we see in caring for senior pets is a lot of dichotomy in how people perceive the pet is doing. Usually one person is going to be the one who spends the most time with the pet, and they're going to have a very clear picture in their mind of, this is what's going on with Rocco. He's here, 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 and here, and we're seeing this, and this problem. and then someone else in the family will, you know, come home at 8 o'clock at night and see a completely different picture. Partly because they're spending less time with them, partly because they have a completely different relationship with that being. And so it can be hard to find family consensus on whether treatment is needed, and if so, what, and whether treatment is working when people don't communicate clearly. And sometimes it's just not being present, sometimes it's grief manifesting in different ways. We all have our own relationships with loss based on our history, based on our culture, based on our upbringing, based on our faith, and sometimes that is just noping. No, he's fine, absolutely fine. He ate yesterday.
Denial.
And it is important to sit down, and this is why one of the things that I suggest when you're doing veterinary care for older pets is to at least once every few visits have the whole family there and sit down and say, what are your perceptions? What are your perceptions? And the other thing I talk about are what are your priorities? And what do you think is most important to you about Josie? What do you think is her biggest priority in her life? And that's where you start realizing that you have people say, oh, that's important to you, I never knew that was important to you, or I don't think that's important at all. And we can't create a good care plan unless we have consensus. But the biggest thing to take home from all of this is that while older pets present their own challenges, there's so much that we can do to help support them and take care of them. Whether that's just, you know, being perceptive and being in tune and being aware of how they're feeling, whether it's being educated and informed about what's going to be happening in their life, whether it's figuring out the best way to medically support them, or just ways to change the way that you behave with them and play with them to keep your bond strong and to keep them happy. And talk to your veterinarian, talk to your vet tech, talk to your care team and say, you know, what's the best thing that I can do, not just to keep my pet alive, but to keep them happy. And I always feel bad for kind of ending on a sad note here, but if anyone has any questions, I am happy to answer them, or stories, or keep pictures of your dogs.
I have a question for
Yes.
my older beagle. We've noticed maybe in the past 6 months that I try to walk the 2 dogs together, but I realize at some point I'm probably not going to be able to do that. But when he gets tired, he sort of walks sideways.
That's most likely because he's favoring a one leg that's more uncomfortable than the other.
Oh, all right.
So I would address his pain management plan.
Okay, all right. Yeah, I couldn't figure out why he was doing that. All right.
There are a lot of things that may be behavioral, but
Okay.
a lot of times it's like when we see weird gaits
Yeah.
in animals, it's usually they're trying to avoid putting weight on or moving one place that is uncomfortable. So we see a lot of dogs that will walk like this, and I was like, oh, then you stop and look, oh, they're not bending their knee.
Yeah.
Or they're trying to move from their pelvis
Okay.
or sacrum instead of their hips. And once we realize, oh, that's where the discomfort is, we can work with that.
The other thing he does when I take a walk, he does what we call plop and drop. He will not budge.
Mm-hmm.
He just sits or lays down.
Is that new, or is he
He's always done
he's
this.
always done it? Okay.
So
He does it at
and
the
this
park.
is a challenge
I have
of,
to
you
get
know,
help. Yeah.
is this his personality being stubborn, or is it that he's tired and uncomfortable?
I
And
think
the way
it's sort of both.
yeah. And I talk about ways that we can detect pain in animals.
Yeah.
But the gold standard for diagnosing pain in animals, and this is from the International Veterinary Academy of Pain Management,
Yeah.
is treat them with pain meds and see if they feel better.
Okay.
That is the gold standard for diagnosing pain in animals.
Okay.
Is, you know, treat it and see if it gets better.
Okay.
And if we give them pain meds and that behavior stops, then you know that it was discomfort.
Yeah.
And what I always tell people is rather than again, this is where I say let go of guilt. It's like, oh my goodness, he was in pain, I didn't know. No, think to yourself, I found out that he was in pain and I fixed it. So.
Is it okay for a dog to be on pain meds like for years
It is better than a dog not being alive for those years.
Okay, I wasn't sure. The first dog we had, he didn't go on pain meds till he had a tumor, he had cancer, so they gave us the pain meds, and so he took it right up until he passed.
Yep.
And I thought, but it was about 8 months, and I thought, what does that do to your stomach or anything like that?
So this is why, and this is why, especially caring for senior pets is a bit of juggling.
Yeah.
I'm going to say, okay, we're going to give you this medicine, but we need to be careful because this medicine is going to affect that medicine, or this medicine is going to cause that side effect, so we need to give this other medicine to treat that side effect. But I would rather have a dog that lives an extra 2 years on pain medicine and tummy protectants than have a dog that was euthanized after a year for being in pain, or have a dog that was in uncontrolled pain for years. And this is why, and it's a matter of priorities. But in general, as long as we are aware of the impact that a medicine has, and we know what side effects to watch for and how to compensate for them, they're generally safe. And if we have a medicine that starts causing negative side effects, then we have a conversation. And we say, we can take out this medicine, what can we put in it instead? Or we can continue this medicine and treat for the side effects. Or, depending on how severe the problem is, we have a conversation so we can choose to continue this medication knowing that it will perhaps shorten their lifespan, but which would you rather have? 6 comfortable months or 12 uncomfortable months? And there's no wrong answer to that. And if someone tells me I would rather have the 12 uncomfortable months, I will see what I can do to make those 12 months at like a 6 out of 10 pain instead of an 8 out of 10 pain. And if someone tells me they'd rather have the shorter, more comfortable time, neither of those answers is wrong. But we also have a lot of different pain medication options. So if one is causing trouble, we can always say, why don't we try, if Rimadyl is causing stomach upset, why don't we try gabapentin? If gabapentin makes them too sleepy, why don't we try amantadine? And I've had animals that are on all 3. But it's a matter of what is best for this pet and what is best for this family. Anything else?
I thought you said about the food was interesting, because Violet had kind of got a little fussy about the food, but he had bought the wrong food, and we were wondering if maybe she just didn't like it, so then we've got another kind of food, she started eating again, so, I mean, maybe.
That's something also to watch out for though, because we see this is more a kitty thing than a doggy thing, but we say, she's just picky. She's just gotten super finicky in her old age. No. Age doesn't make you finicky. Not feeling well makes you finicky. And say, she won't eat this, but she'll eat whenever we give her treats. That just means, again, that she's having to prioritize, do I really want to eat? It has to be high enough value for me to eat. What makes old pets not eat? Lots of different things. It could be that their sense of smell is not as acute. It could be that their stomach hurts. It could be that their teeth hurt. It could be that their back hurts and standing at the bowl is uncomfortable. So then we have to do a little bit of investigative medicine and figure out what is going on here that's making your pet be finicky. And that could be anything from, like I said, her teeth hurt, get her some mushy food, or get her a little, oral care. It could be that, they've developed a little bit of inflammatory bowel problems and they need a gentler, easy to digest diet. It could be that you need to elevate their bowls. And figuring out though that this is not just, she's just old and finicky.
Is feeding a cat similar to feeding a dog? Like obviously we feed the dog the same food every day. And I didn't know about that cats, but our cat will only use Market Basket cooking giblets. That's it.
That's fine.
Okay.
There
If I
is
put
nothing.
anything else down, will not eat it.
We have this mental image that we like variety in our diets.
Yes.
So we tend to project.
Yeah.
And think that that our pets are gonna get bored eating the same thing.
Yeah.
Not necessarily.
Okay.
And I'm gonna just put this on the table right now. There's a lot of hullabaloo about pet food right now. Pretty much anything that you buy is gonna be more nutritionally balanced than what you or I eat on a day-to-day basis. there's something called the American Animal Feed Control Organization, AAFCO. Any food that has on it the AFCO certification is complete and nutritionally balanced. So
What is it, AAFC?
AAFCO. And there's a lot of talk about, you know, this protein, that protein, grain-free, no grain-free. That is an entire separate hour-plus lecture.
Okay.
But I can answer short questions about it. But basically, especially when it comes to seniors, if you're not feeding for a specific health condition, if you're feeding an AFCO certified food, you're fine.
So we don't have to, doesn't have to be swig, because I did, he's a lab.
Yep.
He's a chunky, he was born chunky.
And he's English, so he's gonna be blocky.
Yes, and so, you know, but of course my vet's always concerned about his weight, you know, so he's been on weight control dog food for 5 years.
Okay.
So I did try to, at one point I thought, well, you know, cause he's 12 and because of the weight and his age, he's actually considered geriatric on the charts.
Yep.
So, so I said to my vet, I said, should I change him to like a geriatric, like a, you know, the elderly dog,
Yep.
the elderly dog.
Senior dog, senior dog, yeah.
And she said, well, give it a shot. She said he's still pretty active, so he might not like it. It wasn't that he didn't like it, he had runs.
So whenever you make a diet change, you wanna be really gradual and careful about it.
I was, and it stayed with him, and so I kept him on it for
Yep.
a month, every day.
Yeah. And it may just be that it didn't work with his body.
Did not. I put him right
but-
back on the weight
And then he
control,
was fine with it.
within 3 days,
Yeah.
it was back.
A lot of it is likely to be fiber. A lot of the senior diets are just slightly lower protein, slightly lower calorie. Whereas a weight control diet is usually gonna be slightly higher fiber.
Okay.
We feed senior to our dog.
Yep.
She's 11.
Yep.
And but we particularly look for the glucosamine and chondroitin in the food because we've discovered that after
So
we fed it to her.
glucosamine and chondroitin are super important. They are crucial. They're amazing supplements for anything. There's generally not enough in the food to be therapeutic levels.
We did
That's
notice
it.
that after we started feeding her that food though, her limp did decrease.
Perfect then.
So,
If it's
yeah.
working, if it ain't broke, don't fix it.
So, there is one question online.
Oh, yes.
So Paul asks, I have a 14-year-old Catahoula Hound mix,
Yay.
around 35 pounds, lots of arthritis in the back hips, in both back hips, and one shoulder. We tried Rimadyl and something else, but CBD treats seem to work the best. But now she stopped eating them as well. She's also mostly stopped eating kibble, so we switched to mostly wet food, but there are days that she won't eat at all.
Okay.
I think the question is, do you have any suggestions?
I suggest that you take her back to your vet
Yes.
and have a conversation with your vet, bringing up many of the things that I talked about here. I can't recommend specific treatment. I can't say give this medication at this dose because I don't know why she stopped eating. I don't know if she's not eating because of her arthritis. I don't know if she's not eating because she also has a nasty tooth. I don't know if she's not eating because some of the pain meds or the treats are giving her a tummy ache. But this is a really important situation to call your doctor, talk to them, and let them know what's going on and to help try to create a new pain management plan for her.
Do you have much, I guess, question is knowledge as far as you hearing about CBD?
I am barred by the FDA and the DEA from talking to you about CBD. I am forbidden to tell you things like, there's a lot of research going on right now. I'm not supposed to talk to you about the fact that the challenge with CBD in animals is that we know that CBD does not work in isolation.
Okay.
You need to have at least some percentage or some ratio of CBD to THC. So isolated CBD is not likely to have any significant health benefits.
Okay.
The challenge is that we don't know what that ratio is.
All right.
Should it be 10 to 1? Should it be 100 to 1? Should it be 50-50? We don't know.
Okay.
We also, when we tell you to give your dog Rimadyl, we tell you to give, 50 milligrams twice a day or 25 milligrams twice a day. We don't know how many milligrams per kilogram is a therapeutic dose of CBD. We don't know. Is it 10 milligrams per kilogram, 1, 100? What's the half-life? Should we be giving it every 12 hours, every 24 hours, every 8 hours? We don't know. This is all stuff that is being researched and worked on. What do we know? We know that dogs have THC receptors in their liver that humans don't. So long-term use is likely to cause liver failure. How much is long-term use? Is it a week? Is it a month? Is it a year? We don't know. So the other thing that we don't know is what's actually in those CBD treats that you buy at your nail salon, because either they sell them at, you know, Whole Foods and nail salons and groomers. We don't know whether any of those, what's actually in them. They're not regulated by the DEA, they're not regulated by the FDA. So it says, you know, give one. Is that 25 milligrams? Is it 200 milligrams? Is it in fact just some liver paste that someone smushed together and said, I don't know, I'm gonna sell this? We don't know. So when I'm talking, when you asked earlier, do I treat the owners? This is the biggest thing for that, is people say, I wanna give my dog CBD. And we say, it's not likely to help. It's not likely to hurt either, because while we do know that some, about the receptors in the liver, there's not likely to be enough in there to have a significant impact. So if it makes you feel better to give this, go ahead. But when I'm making my priorities list, that's the one that I'm gonna say, if you have to skip one thing, you're gonna have the least impact on the least negative impact by skipping this. I think in 5 years, we're gonna know a lot more. I think probably in 5 years, we're gonna have DEA and FDA approved products, and we're gonna know precisely how to dose. And do I have people who say, yes, I give this to my dog and they feel better? Absolutely. Has the placebo effect been proven to work in animals? Yes, absolutely. Do I feel that there may be some medical benefit from it? Yes, but I don't know how much. And so that's why when I'm treating an animal, I am more likely to rely on medication that I know has provable evidence-based medicine behind it.
Okay, Mary Ellen asks, do you recommend Rimadyl for dogs with arthritis?
There are many different NSAIDs out there, so I recommend talking to your vet about which one they're most comfortable using. NSAIDs is non-steroidal anti-inflammatory drugs. It's a class of medications. You know, ibuprofen is an NSAID that's approved for use in humans. We don't use it in dogs because it has different side effects. But there are a lot of different canine approved and feline approved, not a lot, but a few NSAIDs out there. Rimidyl's the most common one, but you may also have heard of, you know, Medicam, Duramax, Previcox. These are all, multiple studies have shown, equally safe, equally effective, equally therapeutic. It's a matter of which one your veterinarian has the most experience with, which one they've had the most, seen the most benefits with, and also any individual animal is going to have their own metabolic quirks. Just the same way when I take ibuprofen, my husband takes Aleve. One works better for me, one works better for him. So if you've tried Rimadyl and haven't had a big benefit, you may want to talk to your vet, do I want to try switching to a different NSAID? Also, it's okay to say, you know, I've heard bad things about this medicine, I don't want to use it, that's fine. They're all equally safe. Any medication has some risk of side effects, some risk of negative incidents. There's no one that's safer, but if it's gonna make you worried, it's okay to say, I don't wanna use that, can we find something else? Rimadyl is a drug that I use a lot, but I would take each individual case into consideration.
If you notice you're seeing your dog obviously not really eating its food, but you give like something, human food, but that's fine, are you okay with that, or?
I would wanna find out why they're not really eating their food.
Okay.
Because the fact an appetite change is a sign that something's going on. And would I ever just say, like, fine, just feed them, you know, people food? If that's what the owner decides. If I say, you know, we could do some blood work, we could try treating this, we could do that, and they say, you know, I'd just rather feed her, you know, hamburger and rice. That's fine, but that's an informed decision.
Okay.
And it's choosing to do that rather than doing an extensive workup, which is a valid choice, as opposed to just saying, I guess I'm gonna do this, and not realizing that we could possibly look for an answer.
Glucosamine supplements.
Yes.
Can you give human supplements to dogs, or?
Can you or should you? Those are two different questions.
Okay. Should you?
I recommend using a supplement that's made for use in dogs for a few reasons. One, weirdly enough, they undergo stricter fentanyl regulation than the human ones do. So you're more likely to actually get what it says on the label in a canine supplement than in a human one, which is tragic. 2, palatability. 3, dose. The dose of glucosamine is different for a dog than for a human. So again, talk to your doctor and say, you know, okay, for my 30-pound dog, you should be getting X many milligrams of glucosamine, X many milligrams of chondroitin. And the ones that are made for use in dogs are gonna be easier to get that. Instead of giving like 4.5 human capsules, give one of these doggy capsules. So it's just gonna be easier. Also, a lot of the canine products have additional components in them. I tend to go with one that has glucosamine, chondroitin, MSM, which I can't remember what it stands for, and ASUs, which I know are avocados, soybean, unsaponifiables, if that ever comes up on Jeopardy. But these are compounds that we have found to be beneficial in maintaining cartilage and joint health. So just by the Dasiquin.
My dog eats them like they're treats.
Yep.
Oh, really?
Like he thinks they're great.
Yep.
You know, he doesn't know it's medicine.
Exactly. Oh, that's another wonderful trick for medicating a dog, especially labs.
No clue it's medicine.
So you pick up
His
the pill,
heartworm pill. He's like,
you put it,
heartworm
you
pill
take a look at
thing.
it, you put it on the table and you walk away.
Oh.
And they will go like, oh, it's on the table, I'm not supposed to eat. Yep, this is a tried and true trick.
I've had good luck with peanut butter.
Peanut butter's another good one. Cashew butter or almond butter if you have peanut allergies in your house. Spray cheese.
I've also had good luck with cottage cheese.
Cottage cheese. We have our tricks. Anything else?
Nothing else right now, no.
Thank you so much for being here and for
Thank you,
listening.
it's really good.
And love your senior pets. Yoga mat.
He's starting to, but you know,